Southern California's only high-definition news. Eyewitness News at 4.
Well, you've probably heard the ads, an alternative to liposuction, injections that dissolve fat. Sound too good to be true? Well, the main ingredients of the shots are not FDA approved. So is it safe and does it work? We talked to one local doctor who says it can help, but consumers need to ask the right questions. 34-year-old Lisa Gold had full-body liposuction a year ago. She said it left her body uneven.
I just wanted to, try to be the thinnest I could be, but that surgery really screwed me up.
Instead of more surgery, she opted for something that promised hardly any downtime, a fat-dissolving injection. It requires several shots in problem areas.
You'll feel like somebody really worked you out really hard at the gym.
The main part of the injection is made of ingredients not FDA approved, phosphatidylcholine and deoxycholate, or PCDC.
The fat is broken down. It is absorbed by the body. It is excreted mostly in the stool and the urine.
The injection is marketed under many names: Lipozap, Lipodissolve, and Lipomelt. 31-year-old Jenny Santoni had lipotherapy on her back. Here is her before shot, and here's what she looks like after 3 treatments.
I feel better. I can wear tighter shirts.
This is William Lucas's chin before and after 5 treatments.
For instance, the looser the fat is, sort of buttery, loose fat, tends to respond better than firm fat.
But like all procedures, it has risks. There have been complaints of infection, disfigurement, severe cramping, bloating, and dehydration. In fact, in Kansas, the procedure is restricted to physicians, and they must use it as part of an investigational trial. Dr. Dishakjian says it's common to experience itching, redness, and sometimes bruising. He tells his patients it's considered an off-label use and says many of the serious complications are the result of poorly trained practitioners. So consumers need to ask tough questions.
They need to know the training of the physician, his technique, and whether how aggressive or safety-oriented the practice is. Where do they get their supplies from, and how many treatments has a doctor done in what body areas?
In response to our request, the FDA made this statement. In fact, there are no FDA-approved drugs with an approved indication to dissolve fat. The FDA cannot assure the safety and efficacy of these types of drugs. Consumers need to know that this is a buyer beware situation. These are unapproved drugs for unapproved uses, and we can't guarantee consumer safety. Lisa knew the risks, but for her, it outweighed going another round with liposuction.
I want to be able to look in the mirror and just like what I see.
And one more word of caution, the doctor says lipotherapy should not be used as a weight loss treatment. Rather, it's intended to help with small areas of body contouring. The shots cost about $250, and on average, most people require at least 4 sessions of that. That also depends on the size of the area that's being targeted. So don't just rush in because you hear the ads. Ask a lot of questions.
And a lot of ads. Everyone was wondering about those things. Okay.
All right. Thanks, Denise.